Hello guys, welcome to today's video. In today's video, your presenter here, I.D.E. Henry, taking you through cholera. Alright, so today we're going to be discussing a medical emergency by the name of cholera. So what's there to know about cholera? We're going to define cholera, we're going to mention the causative organism, we'll describe the pathophysiology, we'll state the signs and symptoms, we'll describe its management, and lastly, we're going to describe the prevention. Ready to start with. Cholera is an acute infection affecting the small intestines of the gastrointestinal tract. It is caused by a bacillus called Vibrio cholerae, and it is characterized by profuse diarrhea of rice-watery stew, projectile vomiting, and lastly, severe dehydration. Having defined it, ladies and gentlemen, what is the mode of transmission? So cholera is transmitted through fecal-oral route. So you can get it by ingesting contaminated water or food through handshakes and others. The incubation period for cholera is 4 to 48 hours, and the vector are flies. So the incubation period is 4 to 8 hours, meaning someone within 2 days, if they're not managed, can die, and we wouldn't want that. So quickly, let us go to the pathophysiology of cholera. So when you ingest contaminated foods or drinks, the Vibrio cholerae binds to the cells of the small intestines, all right? Yes, where it multiplies rapidly, and it will start secreting toxins known as enterotoxins. So in your explanation, when you're writing the pathophysiology, you're obviously going to start with the normals, but we're not going to dwell in that, so we're going to continue where we ended. So the Vibrio cholerae is going to secrete enterotoxins. Yes, enterotoxins. These toxins are going to cause the following. They're going to stimulate intestinal mucosa, which will produce fluid, which is isotonic to plasma. All right? This is interesting. Then the intestines will not be able to hold such amounts of fluid, and there will be rapid passage of fluids in form of watery stew, which resembles rice water. That's where the name rice watery stew comes from. Great. So now, the toxins will also stimulate the vomiting center in the brain, and there will be projectile vomiting. Because of loss of fluids via profuse diarrhea and vomiting, there will be severe dehydration. So in our pathophysiology, we're outlining what happens and where the symptoms come from. We proceed. What are the signs and symptoms? So the symptoms appear within 4 to 48 hours. It is that quick and it is that acute. The sudden painless profuse diarrhea known as rice watery, which is due to the presence of enterotoxins in the GIT. Great. There's projectile vomiting. This projectile vomiting comes as a result of stimulation of the vomiting center by enterotoxins, and also severe dehydration, which is characterized by sunken eyes, loss of skin turgor, and pallor. We proceed. There are muscle cramps. These muscle cramps will be due to loss of electrolytes. The intense thirst is going to be due to severe dehydration. Body weakness is going to be due to loss of fluids and electrolytes. And lastly, oliguria is going to be due to severe dehydration. What is the management of cholera? The management of cholera is a medical emergency, ladies and gentlemen. So we're going to resuscitate our patient. And the first heading is going to be correction of fluid and electrolyte balance. And we're going to establish an IV line or an IV access for fluid administration, specifically an 18G cannula, which is going to be a sterile one. And then I will start intravenous infusions of fluids such as Ringer's lactate or normal saline immediately. And I will give ORS, which is oral rehydrative solution, while setting up the drip if the patient is able to drink. The aim is to restore normal hydration and acid-base balance within 2 to 3 hours. So continue rehydrating your patient at a slower rate until the pulse and the blood pressure return to normal. Alright, so in severe cases of cholera, during your resuscitation, you explain that I will give 30 ml per kg body weight in the first 30 minutes, rapid IV to run at least at 60 drops per minute. Then I will administer 70 ml per kg body weight in the next 2.5 hours. Alright, we proceed. What is the subsequent care? So our patient has been resuscitated, and now we are going to diagnose. So history is going to review symptoms such as diarrhea, Remember, when you're writing your nursing management, don't forget to include your headings. So, your investigations, the first heading is history taking, right? So, history taking, you write the following points. Onset of symptoms such as diarrhea, and this is going to review an onset starting from 4 to 48 hours, right? Then, living in an area endemic to cholera, that is going to show that the patient was predisposed, right? Then we go to physical examination. Under physical examination, on inspection, our patient presents with lethargy, meaning there's reduced levels of consciousness. And then on inspection, the patient presents with sunken eyes, which is indicative of severe dehydration. And also, other investigations can be laboratory investigations and lab investigations such as rectal swabs for culture and sensitivity, which will review causative organism, dark field microscopy. The stool is going to show a characteristic darting movement of the Vibrio cholerae, meaning it is going to rapidly move. It's like a rapidly moving bacilli shooting in the stars. Ladies and gentlemen, we go to stool and vomitus culture, which is going to be taken for sensitivity, also in confirmation of the causative organism. We proceed. What is the treatment of cholera? Cholera is going to be treated using these drugs. Firstly, doxycycline 100 milligrams 12 hourly to be given. This is the drug of choice for cholera. Erythromycin 500 milligrams 6 hourly, or we're going to give drugs according to culture and sensitivity. For example, we can give tetracycline 500 milligrams 8 hourly, or ciprofloxacin, which is 500 milligrams per oral twice a day for 5 days, or nalidixic acid. Having done that, ladies and gentlemen, we quickly proceed to the nursing care. Our patient has been resuscitated, we've diagnosed, and we've given the treatment. So what is the nursing care? This is the 50 marks part of the question. Aims: we're going to correct fluid and electrolyte imbalance. We're going to eliminate the causative organism. We're going to prevent the spread of infection. And lastly, we're going to prevent complications due to fluid loss and electrolyte imbalance. Let's start with our immediate care. So firstly, we have already resuscitated the patient and we've used treatment plan C by correcting the fluid and electrolyte imbalance. Plan C is indicative of firstly, intravenous fluids, ORS, zinc sulfate, antibiotics, and referral. We proceed. The patient is going to be nursed in such an environment. Firstly, we will isolate our patient, to reverse barrier nursing and reverse isolation to prevent spread of infection to other patients. So the first point under environment will be, I will nurse the patient in a clean, well-ventilated environment to promote healing. Secondly, the room will be free from drought to prevent secondary infection. Thirdly, I will provide good lighting for good and easy observations. And also, I will see to it that the environment has all the necessary equipment to be used on the patient by the patient, such as a drip stand, emesis bowl, a suction machine, an oxygen source, a wheelchair, and many more. And also, I will nurse the patient in isolation, obviously, to prevent spread of infection to other individuals. Having done that, ladies and gentlemen, let's continue. Observations. I will observe 4 hourly the temperature, pulse, and respirations, and lastly, blood pressure. So temperature will be done to rule out hypothermia and also detect onset of other infections if raised. The blood pressure and pulse are monitored to evaluate effectiveness of fluid replacement to rule out shock. And also hygiene. Daily baths. I will bath the patient daily and I will encourage baths, all right? If the patient is unable to do it themselves, I will assist the patient to do a bed bath or an assisted tub bath. This is going to help the patient keep clean and promote hygiene. Secondly, I will bathe the patient and remove dead cells, and I will change the patient's linen, to prevent the patient from smelling and also to promote self-esteem. Yes, I will change the patient's clothes whenever soiled to promote esteem and also to promote hygiene. I will change the soiled linen to prevent pressure sore formation as well as prevent bad smells. Also, oral care will be done to prevent halitosis and also to prevent and promote good appetite. Having said that, what position do we nurse our patient in? We can nurse the patient on a cholera bed. So a cholera bed enables the patient to be managed well during hospital stay. The patient can assume a position of comfort as prescribed by the physician subsequently. I will change the patient's position 2 hourly so as to prevent the formation of pressure sores. Having talked about that, ladies and gentlemen, elimination. I will provide a bedpan if the patient is not ambulant to prevent soiling the linen. Secondly, I will use a wheelchair to take the patient to the toilet if the patient can sit on a wheelchair. I will monitor the amount, the color, the odor, the stool to determine and assess effectiveness of management. I will maintain intake and output chart to prevent loading overdose the patient and also to rule out renal failure, and I will monitor the urine output as there may be oliguria due to dehydration. Having talked about that, let's talk about ambulation and exercises. I will encourage the patients to ambulate when the condition improves to prevent pressure sore formation and promote blood circulation. Secondly, I will reinforce ambulation as this will reduce muscle stiffness and even foot drop resulting from prolonged bed confinement. Also, in the initial phase, I will perform passive exercises to improve blood circulation, and as the condition improves, I will engage the patient in active exercises as these exercises will prevent postural pneumonia, also known as hypostatic pneumonia. Ladies and gentlemen, how do we prevent cholera? Cholera can be prevented in the following ways. Firstly, use of clean water. The clean water supply for drinking by using chlorine or boiling. Secondly, proper disposal of fecal matter by using flushable toilets or pit latrines. Thirdly, educating the patients and the people in the community on the mode of transmission, prevention, signs and symptoms, and the like. Also, washing hands before eating food. So, washing hands before eating food and also after using the toilet to prevent auto-infection. And lastly, warming leftover food before eating. We proceed. What are the complications of cholera? So we've got 5 complications with me. Firstly is paralytic ileus. The paralytic ileus can be due to bacterial infection. Secondly, cardiac arrhythmias will be due to electrolyte imbalances, for example, hyperkalemia. Also, renal failure is going to be due to loss of fluids. Metabolic acidosis is going to be due to severe dehydration. And lastly, hypoglycemia. Ladies and gentlemen, having talked about that, we have defined cholera. We've stated the causative organism, its incubation period. We've stated the signs and symptoms, its pathophysiology, the management, inclusive resuscitation, and subsequent care. We also talked about the drugs of choice, doxycycline, tetracycline, and ciprofloxacin. And we've also done our nursing care, not forgetting that our patient will be nursed on a cholera bed and will do observations for hourly and the rest in that order. We've looked at the prevention, talking about clean supply of water. We've talked about washing hands, clean toilets, and boiling water. And also, we've talked about the complications of cholera such as paralytic ileus, cardiac arrhythmias, hypoglycemia, and also the rest of the complications. Having talked about that, ladies and gentlemen, thank you very much for watching my video. This marks the end of our presentation. See you in our next video.